Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are talking about how to embrace the implementation of AI in CV care. So we are being joined today by Dr. Thomas O'Brien, president of Heart and Vascular Institute at the Christ Hospital. Thank you so much for joining us today.
Thanks for having me.
All right, this is a topic that we have been talking a lot about, artificial intelligence and how to really integrate it, how to embrace it, how to love it, because it's not going anywhere.
Hot topic. It's coming.
It is.
You better be ready.
You better, and it's here,
It's
really.
here.
It
It's
truly
here.
is.
That's true.
Everyone's just trying to learn how to use it most effectively and also be ready for what's next.
Yeah, it seems limitless right now, boundless too, which is a good and a bad. But as we rein it in and find how to apply it, there's different attributes of AI that we can implement more quickly. The one I've had some experience with is Ambient note writer and how it saves time in the documentation part that we have to do as clinicians.
And that is often something that takes a lot of time. After hours too.
It does,
Yeah.
and that's been my challenge, is trying to squeeze in a full day of patients, do all the computer work that's required. There's more and more clicks on the computer just to satisfy, guidelines and criteria, and still have a nice note that I'm proud of at the end of the day that captures everything that I need that I think is important for the patient's health.
Yeah. What do you think are some of the challenging parts of implementing these AI tools?
Well, change. Nobody likes change,
Right, yeah.
So we have doctors that span the spectrum, young ones that are coming in ready with all the AI, implementation, but then older ones that have had a routine. And disrupting that routine, even if it's short term, is going to cause inefficiencies to an already busy day. And so that's the number one challenge is change and getting people to accept it.
So how does that work? How do you suggest kind of implementing that change and learning in a day that already is filled with activities and patients and notes?
Support from our IT colleagues and hospital staff and even industry and vendor partners that are going to come along. If you're going to embrace something new and bring a product to you, such as AI, a particular vendor that's bringing you a particular note writer, for instance, then there's a support team that needs to come with it so that they can do all the background work, all the, formatting and pre-op work before the procedure or the visit, so that it's an easy button basically for the physician. They just have to click go and they can do most of their normal routine with little interruption.
Yeah, it just takes a little bit of thought and some planning on the front end of it.
Yeah.
So you talked about notes. What else has been some significant benefits that you've seen with AI?
Face-to-face time and satisfaction for the patients as well. So for me, saving pajama time or Saturday morning so I don't have to catch up on the computer, I can spend more face-to-face time with the patient. And the patients appreciate it because I'm no longer just staring at the screen, but they feel listened to. Even in a short amount of time, the time I spent with them didn't change, but just the time I've had to connect with them. Verbally, eye contact, body language toward them instead of the computer. They feel heard, they listen to. Sometimes I pick up on some things too, and it can advance their care.
I think I'm a journalist, and I've been using AI a lot to transcribe interviews.
Sure.
And I find that I'm asking deeper questions, more questions, because it gets translated, and I don't have to listen to it and write everything down. So to your point, it does allow you to go a little deeper, knowing that information will come right back to you.
That's right.
Yeah. So if you could share one piece of advice with organizations looking to follow this same process, kind of how you're integrating this notes or any other AI that you're using, what would you advise people to do?
Get going now. That's number one. And then incremental. Bite off something that you can chew and get the right group of people to start it. As with anything, a small test of change, and be ready to then show that success. Celebrate the success. That'll get your buy-in so you can spread it far and wide.
And when you say people, are these your staff members and maybe patients too that might be okay with being test subjects? I mean, I don't want to say test subjects,
the
but
patients haven't been a problem, so we didn't
okay.
have to wait and get the right selection of patients or the right audience. It was the providers, and the best way we found the right group was just volunteers. Those who were willing to take the time, make the change. They came forward, used those volunteers, and those were the ones who had success and celebrated it, and people listened to it. And now we're rolling it out from the pilot of just 50 providers now to over 1,000.
Wow.
Yeah.
And how do you sell that to those first volunteers who say, I'll try?
It wasn't very hard,
Okay.
honestly. It's people that it's new tech. Oh, it's trendy, it's
Right.
sexy, it's AI, and
Right.
want to play with it. And you'll find the right
Give them a little
the right
time
interest.
to
Yeah.
work with
Yeah.
it. Where do you see this going? We used to say 5 years,
Yeah.
but let's say even a year from now.
Yeah. I mean, picture it if you're the patient, for instance. Now you come in. Yes, the doctor's talking to you face to face, and there's just something you don't even notice that's listening in. We have a normal conversation that transcribes the note for me. Great. That's step one.
Right.
Step two, at the end of the visit, I say, oh, we should increase that medication, double the dose. And which pharmacy do you want to send it to? Oh, Walgreens. The computer already sets it up. All I have to do is hit click, and it's there. It's at Walgreens before you leave the room. Then I say, let's see you back in 3 weeks because I want to check and see how it's going. And this is the availability on my calendar. The AI is integrated to my schedule, already puts up a proposed appointment time, sends it to the phone number you have listed in your chart, your cell phone. You get the alert there in the office, and here's the alert, and your phone automatically checks it against your calendar. Is that going to work for me? And you just have to hit accept. And before you leave the office, your appointment's made too.
And
so
those are things that took extra people.
Yeah,
a
and
whole
extra
lot more
time.
time. Yeah.
And some frustration in the process
Right.
that hopefully goes away.
Right. All right. Thank you so much for sharing that. I hope that's something that you can get excited about because to your point, you got to jump on now because AI is not going anywhere. So learn it, use it, and it certainly will make life a little easier
For all of us.
for all of us. All right. Thank you so much for this conversation.